Good morning, everybody.
Good morning.
Happy hotel coffee. It's been a while since we've given an update about what's going on with my health situation, and we are here in New York City this morning to address that. So I do have a playlist going if you want to check it out on my channel. This is the fourth in a series of updates. But I thought since it has been so many months since we've talked about it, it might be a good time to kind of tell an abbreviated version of what all's been going on. So I believe this started in January of this year, 2024, when I just went for a routine dental cleaning and the x-rays showed something abnormal. Followed up with a different dentist because the first dentist wasn't really sure what was going on, and she said that there was a large piece of my front jawbone that was like missing, eroded. There was a hole that was eroding through my jawbone. It had almost gotten all the way through to my tongue, and she didn't really have any idea what to do about that. It was above the level of a regular dentist. She thought I needed a root canal, went to an endodontologist. He said all of my front teeth were alive and healthy and a root canal was not what I needed, but his recommendation was that I probably had a cyst of some sort and I needed to see an oral surgeon. By this is now middle of February, I suppose.
Yeah.
We found an oral surgeon close to where we lived in Florida. She did some 3D images and was actually able to see that yes, what I did have was a cyst. She's called it a tumor, but it is not cancer. And she said that it's going to need to be operated on. I was welcome to go get another opinion, but it needed to be operated on soon. We chose to go ahead and do surgery that day. She did remove as much of the cyst as she could. It took about 45 minutes. She removed as much of it as she could see. There was so much bone missing that she placed a bone graft on the site and then sent what she scraped for pathology to the University of Gainesville to see what exactly was growing here in my jaw. And when the results came back, it was a type of cyst called an odontogenic granuloma, which is what I'm calling this playlist if you're trying to look it up. Turns out it is super rare, and it does not really have any course of treatment that we are very comfortable with. She referred us to go to the University of Gainesville because her thought was that perhaps these oral surgeons who are, much higher level than the one in our town would have some different type of surgical options for me as far as, if this cyst were to come back. It has an extremely high risk of coming back. So we went there, but that was when they presented us the only option for treating odontogenic granulomas, and that is a jaw block, which if you don't know what that is, I don't know if I really want to talk about it in this.
Yeah, the University of Florida, that was their only treatment because, like Julie said, with the high rate of recurrence, they believed that what they needed to do was cut away what was being affected because it's ultimately just a stem cell that has had its switch turned on and is softening Julie's bone. We didn't like that.
That option would involve removing my jawbone, gums, and teeth from this side of my mouth a little bit further on that side of my mouth, the space of at least 5 teeth, which would have been a horrendous surgery. It would take a year before they would be able to shave off part of my hip bone and then build me a jaw back. I would be on a feeding tube for this amount of time. It was not an option that we're comfortable with right now, but it was the only one presented to us by the University of Gainesville. So we went to another oral surgeon, the third one now in Florida, who was on the board of oral surgeons in Florida, just to see if he had ever heard of anything different, but we got the same answer that we got from the first 3. So the one thing all the oral surgeons do say in common is that because my surgery was in February, I needed a full 6 to 8, more closer to 8 months to recover from the surgery that I had done kind of on the spot and let that bone graft heal as much as possible before there was even any point considering more surgical interventions. I had to heal from the first surgery, and there was nothing they could do until that time. So we decided to make the most of our summer We went to Columbia. We have now resettled, at least temporarily, in North Carolina, close to my family, largely because of this and wanting to be near a support system. And Michael has been spending his whole summer basically looking for alternatives for me. And the best thing that we have found so far, I'm not going to mention names or clinics, although it might not be hard to find, is an oral surgeon here in New York City, which is where we are today, who has performed thousands of surgeries on these types of cases in adults and children, and has written at least one paper, many papers, I don't know.
He's written many papers in 2 different institutions of different methods, a few different methods that he uses.
We don't know anything yet. We are fixing to go for a consultation here in a couple hours. We'll keep the vlog posted for that.
I just want to tell him, like, I've spoken to him on the phone, and we have traded many emails back and forth.
Mm-hmm.
So at a cursory glance, he knows what Julie has. He actually called the University of Florida to have her pathology results sent to him.
He ran pathology results a second time to confirm the diagnosis of the odontogenic granuloma that University of Florida had given us, which actually very much impressed us. He has not even charged us for that, at least not yet.
So he's
dealing with before we show up.
He's a true researcher. He's a very humble, seems like a very humble guy. And he said, when Julie is ready to come in for a consult, I will take her on as a new patient. I said, well, the surgeon asked, near the end of fall, if you will, and he said that's fine. So I called his assistant once we got back in settled in Charlotte, and she said, can you come this day? And we said absolutely. So that's why we're here today. We have about a 15-minute subway ride when the appointment is at 11. And we from what I've seen and read about him, I already trust him as much, if not more. University of Florida does write the textbooks. I will say that. They are the gold standard in dental surgery. However, he, much like us in our own lives, have decided to try new things to get better results than just to cut away the bone that seemed very barbaric and medieval to us. And so he has found a few different techniques. We do not know where we are in the stage yet. So we are going to go today, and Julie will have a follow-up scan, and we will consult with him.
Yeah. I did have a follow-up 3D image taken 3 months after the surgery was done. And everyone was shocked everyone was shocked how much I had healed.
Yeah.
Which is apparently potentially a bad sign, because the bone healing too fast could be that the cyst is depositing calcium and creating bone too fast. It could be a sign that it's growing back already viciously. It could also be the fact that I live on an extremely high protein diet. I basically have drank bone broth and eggs every morning of my life for 4 months after the surgery, and ever since we got home from Columbia, that's what I've been doing. So I'm not discouraged by the fact that I'm healing too fast. Yes.
Just so everyone knows, I did talk about this in greater detail, but with Julie, with all of us, she's still of the age that she has red bone marrow left in her long bones. But our face, our flat bones, always have red marrow. So that graft is why it's so important that it takes, and it took so long to heal. So yes, they were concerned she was healing at twice the rate of someone her age, but she also didn't go home and have milkshakes and ice cream because she couldn't chew, right? So
the oral surgeon who did my original surgery was like, guess what? You can eat ice cream and yogurt and smoothies until you heal. Well, it's now been 8 months, and I still have pain here almost all the time. I don't know if I can see when I'm editing my videos, when I'm not speaking, the things I'm doing with my mouth, trying to relieve how much discomfort this jaw has been in since the bone graft. It's not pain, it's just uncomfortable. And she told me I could go home and live on all of these things, and I didn't. I went home. I think I fasted probably at first because I couldn't eat. As soon as I had an appetite again, it's been bone broth, eggs that I poached very lightly. I was living on, I have had a diet that should support quick
bone
deposit and cell turnover. And but again, this to wrap this up, what I have is apparently genetic. It has not happened to anybody else in my family, but my combination of genes just happened to give me this at the ripe old age of 38. It was always destined to happen. I didn't do anything to cause this. I didn't fail to do anything to cause this. I can't blame it on my parents. There's nothing I can do. This is a genetic thing. It's odontogenic granuloma. It is not cancer. It is not fatal. It is just a tooth or teeth is creating the secretion of stem cells that are turning into a cyst that is basically eating my jawbone away and sort of cutting it all off my face. And we are desperately looking for alternatives, and we're very excited to meet this doctor today here in New York City and see if he might have an alternative for us. So this has gone on long enough. Let's.
He does. I found his research. We even took his research to the local guys because we had trusted Florida where we were up to that point, and the local guys say, we're not comfortable with his technique. Fine, we'll go to the source. And so that's what we're doing. And I don't want to say excited, but I will tell you that what I've read with his studies encouraged me greatly on what he can offer, because the one thing that I want you to realize that if even we decide we don't want to do what University of Florida is asking us to do, you can still only go back in there, right? So many times this bone is only so thick, and so we want it done right. And I think this is the guy in the U.S. and maybe even the world as far as how innovative of a treatment that he has. So
we are hopeful. We will update you after this appointment what he says and what the next course of action will be.
Yes.
Wish me luck, guys, please.
We'll see you again soon.
I'm too emotional to talk right now. I will update very soon, but it was actually really good news.
It was amazing news.
It was so much better than I ever even would have dared let myself think.
I know.
And I'm kind of overwhelmed. I'm very grateful and happy, but I'm just emotional, and I can't continue to put.
It shows you.
I can't talk about it right now.
An amazing diet and clean lifestyle will do for a body that will allow itself to heal. That's all I will say. It was amazing news. It wasn't just good news. She's downplaying it because she doesn't want to cry. It was absolutely amazing news. He was happy. He was astounded.
They were so nice. Oh my God, I was not expecting such nice, patient, calm.
They were amazing. And he said, go back to your other surgeon. We're like, no, sorry. We're
she was fantastic too.
You're going to have us.
But I will be back here to see you. We're going to be following up in 6 months.
It was just astounding. Looking at the two pictures side by side.
I feel like I'm going to fall down. So we just need to get back to the airport, and we're going to go home. And we'll tell you everything in tomorrow's
We love you,
video.
New York. We will be back. We will always be back.
And
unfortunately, this is an overnight whirlwind, but it ended amazingly. So we're headed back to the airport now.
All right, we're in the airport, and I've had about a couple hours now to kind of collect myself, and I feel a little bit more ready to speak.
Okay.
Actually, I think I'm gonna let you do the talking.
Okay.
We did a repeat 3D image, which I had not had one since I think April.
Mm-hmm.
So I had no idea what we were looking at. But when the doctor walked in, he didn't talk to me about the results of the 3D image right away. He said, I just want to get, since it's my first time meeting you, the whole story from your perspective. So I started with the story I told you all this morning.
Mm-hmm.
Found it in January, had an operation on the spot in February, have seen 3 oral surgeons now. And he said, well, let me show you the image that I took But first I'm going to show you the image that you brought me, which was the one with the very large cyst on
The
it.
first,
that you can see.
the initial scan.
That image would be in the first video in this playlist if you wanted to go back and see it.
He said it was about 4.5, about 3 centimeters, so a little over an inch by
very large.
half inch. And so he asked Julie to take him through what the doctor in Florida did. Smoking's not allowed in the terminal, and said that he thought she had done a good job. He felt inside and outside of Julie's jaw, testing the integrity, and then showed the new image and showed where you could still see the edges of where the bone graft had went initially. But since the shadowing was almost exactly the same as the healthy bone that Julie has always had on either side of that spot on her lower jaw, that indicated to him that her bone had not only fused with the cadaver, but had dissolved the cadaver and made its own bone. And
which I asked because when you start talking about dissolving the transplant, I said, is this good news or bad news? And he said, well, I hate to be the bearer of good news, but this is great news.
Because I was like, that's great. And Julie kind of sat there stunned a little bit.
I was so stunned. I really kind
of
stopped.
She hadn't had good news from anyone yet.
I counted it up between dentists, odontologists, root canal people, 3 oral surgeons. I have had bad news now from 7 professionals in a row. Not
Since
good
February.
news from anybody. So I didn't even know that this was good news. And I was like, well, what does that mean? Because I had been told that if my bone healed too fast, it's another sign that the tumor is growing.
And he didn't even question whether or not it was her bone
He
healing.
said, I can't see any signs of the cyst on this 3D image.
He when he ran his fingers along Julie's chin, the only thing that was not completely normal was a small edge at the very anterior portion, and he said that's normal right now. That would take the longest to heal, to kind of smooth that angle back over, and that the reason she might still be a little bit uncomfortable or have a little bit of pain here and there is simply because the nerve endings are now fusing back together, and we weren't sure if that was going to take place or if they were dead. So, of course, when you get told by another surgeon months ago that if you feel pain, that could be another indicator that it was coming back, had Julie concerned too. But we couldn't take 3D images every few weeks or even every month. And so we were told, wait until, late fall and then start looking again because we won't have a clear picture.
Operate again if it was coming back.
But then, even if that was good or okay, we're going to see you for the next 3 years every 3 months. That's not the answers we got today. It looked so good today. Number one, we didn't have to do a CT. That's great. We didn't have to do any more imaging. Number two, he said, I'll see you in 6 months. You didn't need to see her in 3 months. And number three, if it ever comes back, he did not give her a percentile of how much, like some other folks have.
They all said
recurrence.
70 to 80% chance, absolutely, definitely would not be able to avoid that this would come back.
He said Julie's surgeon did an excellent job, and that he did present, if we had to do it again, it was an alternative therapy.
Not even a therapy we knew of.
Exactly.
From doing our research on his research.
Even
he does
his
something.
Research.
He said, I don't even do what I published in those papers. I don't even do that anymore.
There's
I have
more
something
innovative
better.
stuff now. So he does stuff even better.
Instead of cryotherapy, he does curettage.
So he'll use a laser
and heat.
That way you can be precise when you're killing those stem cells. Cryotherapy just kind of wipes out, tissue, surrounding tissue. But anyway, I could not have asked for more from someone we consider, at least on paper, to be the biggest expert on this in the U.S., possibly, like I said earlier this morning, in the world. And so he was so down to earth and talked so
great
They were all
to
so
us.
nice in there. He brought in a pathologist to talk to me too, because he said he wanted to be absolutely certain that we knew not only what I'm dealing with, but what specifically is the origin of why this was happening to me.
Yeah.
And he assured me that this is incredibly rare, and that doesn't make me feel any better.
Right.
But he presented several options that he can do, including what he would recommend should it come back. Right now, there's no signs that it has come back, but we are not going to drop the ball on follow-up. So, of his options, we went ahead and took jaw block right on off the table.
So that wasn't even an option he was considering.
For me, that was kind of when I almost stopped hearing anything else he was saying, because it has been my biggest fear all of this time that's where we were headed with this. And the whole reason I wanted to vlog this whole series was in case anyone else is going through this and felt as hopeless as I do.
Yeah. He was also so confident in what he saw on the scan that he didn't concern himself with seeing Julie again. He thought we were just doing a consult.
He said I could continue to follow up with the oral surgeon that did the original surgery if I want to.
Nope.
Absolutely love her. Would let her do operations on me any day of the week. But I feel like I am here because I want to be sure I'm following with a practitioner who understands how diametrically opposed I would ever be to a jaw block, and has multiple different alternative.
He did. Yeah, he presented at least 3 different alternative
ways it could
therapies.
be done. So absolutely not.
Exactly.
I will make the trip to New York City from wherever I am in the world. Anytime. He said, come back sooner than 6 months. If you have anything go wrong, or you feel anything, you see anything, you think you need to have a scan, I'm more than happy to see you sooner. But wherever I am in life, I will be back here in 6 months. Yeah. Because I trust him that much.
I think another thing that gave me more confidence than what mainstream textbooks that I could find told me was, even in best case scenario, if this thing is aggressive and you have it done 3 times, really you're out of options except for a block resection. And today he presented worst case scenario was, okay, if I've got to do this once every 4 years, then we'll do it. Your jaw's strong enough to handle that. And so that encouraged me as well. Just to know what he's already thinking long term, right, with possibilities, and making sure that we conserve every piece of bone tissue and muscle and nerve that is in there, and teeth. And so he even took removing teeth off the table today as well. So again, I don't know that I could have asked for anything else. His bedside manner is the bedside manner that I think Julie and I entered healthcare with, but you don't see it as often anymore, just simply because of multiple factors. But to have him come in and introduce himself as Brian and then talk us through everything
first thing he wanted
great.
to do was get a thorough assessment of how much did we know and understand about not only what is happening, but what are the treatment routes. He's like, start at the beginning. I want to hear everything. He wrote down the names of everybody, the names, the clinics, the dates. He wrote it all on a piece of paper. And then he's like, all right, so this is what they presented you at University of Gainesville, Florida in Gainesville. He said, we're going to start by just putting that off the table. That is not an option we're going to even consider. Which for me was just
we thought that was the eventuality,
That's when they
right?
had to hand me tissues, because I started crying. I thought that was the thing where kind of like skirting around, trying to avoid, but probably
Well, that's
can't.
what they told us at Florida. They're like, look,
it's inevitable.
When you're ready to come back,
We'll give you 8 to 12 weeks of mental health counseling, and then we'll full steam ahead with this horrendous medical mutilation. And he's like, so let's just go ahead and take that one off the table, and then let me tell you some other things I could see ways that this could go. And he said, but I want to talk about your x-ray after he presented these 3 options. And he's like, I don't see any sign. Am I saying this correct? He said, I don't see any sign that it's bad.
Oh, no, he absolutely said that. Yeah.
Which was
and Julie
in
kind
my
of just
wildest
stopped.
dreams.
He was looking for a reaction from somebody. And I'm going, that's great. And I touched Julie on the shoulder, like, and she just started crying because it was like, I did hear that right.
Such an unfathomable toll on my mental health over the last 6-8 months. And I've tried very hard to keep all of that off the channel, but it has been behind the scenes a complete nightmare.
You just come off of getting hit by a truck
Yeah, a
getting
year
back
ago.
to 90, maybe 90%,
Yeah.
85, 90%.
I just finally recovered from that, and it has been for me such a huge part of my life for the last 8 months.
Yeah, whether
The
you wanted
fear
it to be or whether
and
you thought about
anxiety,
it or
the
not.
nightmares, waking up all night long, the tears, the drama. Michael has been through hell trying to support my mental health, and I've been doing everything I know to do for my mental health. And then I never even let myself dream that there would be. I had best case scenarios that I wouldn't even let myself think about or dream about, and they were not as good as what the news we
My
got today.
best case was the 3 months. I thought we would have to come back a little after the first of the year, maybe before my birthday, and have it scanned again.
I thought the best case scenario would be he could operate today. Second best scenario would be he would say, I can get you on my schedule like next week if you can get back up here. And I thought, here we go again. We're going to start from remove the bone graft that I've been trying for 8 months to heal. And, you know, I never actually thought there would be life after today that didn't involve surgery and rehabilitation and
Of some
counseling
sort, yeah.
and plans for debilitating. I mean, the surgery I went through, I was off YouTube for, I was not on camera for, I believe, over 2 months.
Yeah.
It was a very long time because of how much pain I was in, how swollen I was, and that was supposed to be the the minor surgeries.
Yeah,
The
that was
major
supposed to be where you start. But she clearly did. She said she went aggressive. To have him say today that it was excellent what she did gives us confidence that she did get as much of it as she could. Whether or not that's the end all, we don't know. But right now, it is nowhere there. The signal has not done anything. You can even see in the light. Look at how much blood supply is going right here versus the rest of your face.
My chin is always red. I can see it when I'm editing
It's just
photos.
telling you, your bone turnover is amazing right now there. And so
I asked him, what can I do to prevent this from coming back? What did I do to cause this? What did I not do? And he's like, you didn't do anything to cause it. You can't do anything to prevent it. You didn't skip anything. He said, it just genetically, this just happened to you. And it's really rare, but I know that it's happening to other people. And I like to pride myself and say, oh, my bone healed so fast because I drank nothing but bone broth for 8 months. But there's no tellings that even that had anything to do with it.
You know, all the UV, none of the cofactors of what normal American standard diet or
I'm not going to sit here and try to take any
cigarettes
credit that isn't due. But I will say, if there's anybody else out there going through anything like this, keep doing your research and find
that's all. Yeah, that
find alternatives. Do not take a big scary person in a white coat at their word. If it doesn't resonate with you and it doesn't align with what you believe, find someone else.
There are people. Yeah,
there are people. If you need to
will.
reach out in the comments or the email address associated with this account, we will be happy to share the names of where we went and things, but I would prefer to keep that out of the video. But please do your research. Michael found this doctor. It took him a very long time and a lot of work, but he found him.
There were 5 guys that I'd emailed at different research universities. They all did get back to me, very, very thankfully.
Don't be afraid to reach out.
It was just at a Gmail address. They didn't know who I was, but
don't be afraid to reach out.
Exactly.
Do not think you have to get a referral. Do not think you have to talk your provider who does not want you to follow this course of action.
Exactly.
Don't think you have to take their no as an answer. Reach out. Find somebody that aligns with what you believe, or at least exhaust every opportunity. That's what we were prepared to do.
Yeah, we started local, right? We didn't like what they were saying.
We decided to relocate to North Carolina. Didn't like what they had to say. Here we are.
And here we are. And, thankfully we have the ability to run this down. But even if we had to bus here or drive here,
we're doing the legwork, so you don't have to.
Yeah, we would have
if you
made
have
it here.
Going on what I have going on, come where I went. Just call.
And
just get in.
Everyone in that office was just amazing. They had continued to keep track of Julie for weeks at a time after I first initially emailed them, and they didn't have to respond. This is a very large academic institution. They did not have to respond to my email at all, and they did. So
he got back to you the next day, which I believe was a Saturday. off hours.
I want to say that's
I want
right,
to say
'cause
it was while we were in
traveling,
Columbia.
yeah.
Personally reached back out to Michael after Michael sent the email from the doctor himself and said, yes, I will absolutely see her. This is the number of my secretary. Call her and make an appointment.
He immediately
and then he
put,
phone called Michael after
did.
we got an appointment set up. And I was way too emotional to have been able to talk to him. I actually left the house while Michael talked to him, but he called Michael to hear it all from his point of view and said, of course, I can't tell you how this is going to go until I meet her in person and do my own assessment and take my own images and follow up with pathology. But I will absolutely, sight unseen, he was willing to take me from South America at the time. He's like, yes, I will take this case. And I could not believe he didn't put me through, well, you need a referral. Well, you have to have XYZ insurance. Well, you have to, have exhausted all of these things first. He didn't do any of that. He's just like, come to my office, give it this many months after her surgery to heal before you do.
Yeah.
We got here as fast as we could, trust me, like to the day.
For his schedule and ours, he's only in office on Wednesdays. Yeah. So
to the letter of the day from my surgery, as soon as we could get in, we did. And I can't even tell you just how much that means to me, how grateful I am that he was willing to see me, let alone
him. We were just happy for somebody on his team. We said, anybody on your team, as long as you're going to read the notes, and he decided to take it himself. So again, that's a very big deal to me because I'm sure he's busy. He doesn't need to do that. He doesn't need to do more research.
So nice. They were all
anyway,
so nice.
I couldn't have asked for anything better. The process was easy through the hospital and everything.
This is better news than I ever even dared let myself think about hoping for. 6 months from now we will do, and I'll be bringing the vlog right along for that. We'll do another X-ray in
April 23rd.
April 23rd, 2025. I'll be in New York City. I'm gonna have to get off here because I'm really fighting getting emotional again.
But no, it was excellent. It was great. We will, switch courses mentally, and now
this has been for the last couple hours, about 3 hours now since we left their office. I feel like years are blowing off the calendar. I feel like I'm getting. I realized I don't have a single plan on the calendar past today. It was like I thought my life was ending because I knew that there was this life-altering surgery on the
table. I'm going to be able to eat food for the holidays.
My birthday is in a few weeks. It's like I won't be able to smile in any of the family photos. Don't even know if I can go to the holidays. I have no plans. I have not got one thing on the calendar after this, and it's kind of bowling me over to think that I can move on with my life and not have to even really address this for 6 more months. A lot of gratitude.
To not have to have, I think it's a very big deal not to have the CT scan. He was so confident in just the image that he saw. That's pretty spectacular. So, yeah, it is. It's quite remarkable. It's not statistically what should have happened, but has. And we continue doing what we're doing and live our life to the fullest and be back here in April and to get the same image, I hope. So,
thank you for everyone who's left such nice comments on the other videos in this playlist and people who've been rooting for me because it means a lot. And I'm probably going to have to do another video when I'm a little bit more clear-minded about how touched and grateful I am for all of that. But right now, there's your update. That's what we came to New York City to find out.
It is.
And unfortunately, we don't have a few more days in town to celebrate. I wish we did. I would go to every show. I would eat at every restaurant.
Go to Patsy's.
I would go everywhere and do everything if I could. But we have to get home. We have things we have to do.
We do. We have, gosh,
Michael has a job.
More big stuff to
I can go find a job.
To do. Oh my gosh, stop.
All right, guys. I don't know how to end this vlog, so I think we're just going to say,
thank you.
I'll tell you what, Adam the Woo style.
Okay.
The vlog
is
over.